Well, how is your heart? Have you had it checked lately? Heart disease remains one of the most common health concerns among Americans, but we are really lucky here in Arizona to have specialists trained in the latest heart health technology to get our heart back in shape. Dr. David Pretzman is an interventional cardiologist from Biltmore Cardiology, and he's here this morning to talk about some of those interventions. Thank you for being here.
Thank you. It's a pleasure to be here.
Before we get to all of this and what this can do to help people with their heart health, tell me about Biltmore Cardiology. How long have you guys been around, and how long have you been around in this business?
So I am, like a lot of other people from Phoenix, I'm a transplant from a different area of the country. I'm originally from New England.
Okay.
And after I was in practice for a few years, I had a great opportunity to come to Phoenix and do a structural heart fellowship at Abrazo, Arizona Heart Hospital for 1 year. That's how I got connected to Biltmore Cardiology, which is a group that's been around in the Valley for over 30 years.
Wow. Okay.
We have clinics available from Arrowhead, Peoria, Surprise, Buckeye,
all over the
place. And,
I love it.
You know, we're a unique group that has a lot of physicians with multiple subspecialties that treat every area of heart health and even peripheral vascular disease.
All right, I want to circle back on the structural heart disease that you did that fellowship in. What does that mean for patients? What kind of conditions are they presenting with that you would treat?
So the understanding of structural heart disease is really getting at the point that the heart is a mechanical pump, and blood is being supplied to the rest of the body and the other organs primarily from the heart. Structural heart disease is managing the complications that happen from heart failure, whether or not it's from one of the chambers of the heart or if it's from the valves, which is predominantly what we end up seeing. But patients also can be born with congenital heart defects that can lead to complications, and all of it kind of is intertwined with each other. So structural cardiology deals with the management of those complications respective to what is actually causing the problem.
Okay, all right. That's really fascinating, and also fascinating is the interventions that are now available, the tools that you have to treat these patients. We know medical technology continues to advance. It's a very good thing for the patient, makes it a lot easier. Talk to me about some of the interventions that you're able to use now that you maybe weren't 10, 15 years ago.
Sure, and that's the great thing about cardiology is that it's the #1 cause of death in this country, and it's actually more common than all 5 major cancers combined.
Wow.
So a lot of different things that we have available here deal with primarily, you know, whether or not we have valve replacement or valve repair, which takes up the predominant amount of treatment options that we provide. This is giving an example of a TAVR valve or aortic stenosis, which is a minimally invasive procedure called a TAVR for short, where we can go in through the artery in the leg or some other access point to be able to replace a valve, which is a lot different for patients and a lot easier in a lot of respects for quicker recovery time, potential less complications, as opposed to open heart surgery.
That is wild that you can go through the leg. I mean, again, the technology, you know, you don't have to have that big major surgery that would, you know, have you in the hospital for several days or weeks. You know, I mean, it really is incredible what you're doing. As you've been doing this over the years and you've been treating these patients with this technology, what's the message that you have for patients as far as their heart health? Because obviously educating them and making sure that they are living their best life to keep their heart healthy is pretty important.
Sure. Most of the patients that we end up seeing are a little bit elderly, not to say that we don't see younger patients, but in general, the biggest thing that I hear with my patients is that they attribute their symptoms to getting older. But the reality is that coronary artery disease, valvular heart disease, or other structural disease, they're presenting with the same symptoms. So if you're feeling fatigued or short of breath, which can be very vague, you know, you don't have the same exercise you used to have, there could be something more going on than just attributing it to the common thing of, well, I'm just getting older. Exactly. So it's important to make sure that if you are symptomatic, that you should seek help. Go see a cardiologist.
All right. Good information. Really fascinating what you're able to do. Thank you so much for being here today.
Absolutely. Thank you.
Biltmore Cardiology's Arrowhead campus is located near 67th Avenue and Union Hills in Glendale. Call the number on your screen or visit biltmorecardiology.com for more information.